You go to the doctor's office to get well if you're sick or to get vaccinations if you're not. You certainly don't go to the doctor's office with the expectation that you might become ill as a result of the visit. But Lisa Guerrero says when our team checked out a number of medical offices, what we found could make you sick.
I'm going to look in your ears, okay?
It's no fun going to a doctor's office, especially if you're a kid.
Take a deep breath.
But could a checkup have some unexpected consequences, like getting your child sick?
We've all been there, sitting in a waiting room in a doctor's office. Well, we got to wondering just what kind of germs could be lurking about, especially in a pediatrician's office. So we did some testing.
We visited 10 doctor's offices and swabbed all sorts of things, like toys and magazines. Before telling you the results,
can I see your teeth?
We went to the office of pediatrician Diane Hess, who is obsessive about keeping her waiting room and examining rooms clean and disinfected.
Are all pediatricians' offices this clean?
Definitely not.
Just how clean is it? Dr. Hess and her staff clean the examining rooms after every patient, which could be 15 times a day. They also clean the waiting room at least 4 times a day.
Because a child puts their hands in their mouth and touches a lot more things, I think that there might be more objects that can spread germs around, so we just try to be really safe.
So what did we find in our exclusive tests? In 5 out of 10 doctors' offices, we discovered Staph aureus, a bacteria that can cause skin infections and pneumonia. We revealed the results to Lisa Moo, the mother of 2-year-old Morgan.
That's horrible. Yeah.
Disturbing, right?
Right, very much so. As a parent, I will be really worried.
So what can a concerned parent do? 1, insist your doctor has a bin for toys that have been played with and need to be sanitized. That way, potentially germ-infested items don't get used again and again. 2, ask how often the waiting room is cleaned and disinfected. That also goes for the examining room. The more, the better. And lastly, wash hands. Use the sanitizer that's in most doctors' offices, but better yet, use soap and water.
We just want to make sure that nobody catches anything that could be prevented.
Some doctors' offices have different entrances and/or waiting rooms to separate sick and well patients.